Okay, so she needs to
Put Tanya as a host?
Yes, please.
Okay.
Hi, everybody. Can you hear me? It's Tanya.
Yes, we can, Tanya.
Great. All right. So can you see my screen?
Not yet.
No, we cannot yet.
Okay,
You
let's
do
try
share
again.
screen on the
Share
bottom.
screen. Share. How about that?
Yes, it's coming.
All right.
Perfect.
Yeah, that's good.
You're on.
Okay. Great. Thank you. So I'm Tanya, and I'm a registered veterinary technologist currently working at the University of Calgary Faculty of Veterinary Medicine. So I'm just going to talk to you about two organizations that I've been very fortunate to have been a part of almost from the beginning. And I just want to talk to you about how they started, which was quite small, and where they're at today. So the first one I want to talk to you about is the Northern Community Health Rotation that Dr. Coots has mentioned a few times. It's part of the University of Calgary Faculty of Veterinary Medicine curriculum for fourth-year vet students. It's quite a popular rotation that only fourth-year students get the chance to do. It's just the way it is. Other students have to choose other rotations. So 4 very lucky students get to come on this rotation with us every single year, February month. So it began about 14 years ago, give or take, when Dr. Coots was working in the Sawtoo with a wildlife biologist, Alistair Vish, and they were studying caribou and muskox at that time. And she noticed that people were, from the community, were asking her about advice on their own pets, their dogs, their cats, had questions and things like that. It was also clear that there was some issues with packs of dogs in the communities that were causing problems. So it became kind of clear that these communities needed some help, some veterinary services. So Dr. Coots and Alistair discussed this with the communities and got the okay. And then pretty much in 2009, Dr. Coots and Alistair and some faculty from the University of Calgary Veterinary Medicine and some staff, they all made the arrangements and went to the Sawtoo to offer some vet services to the 5 communities. So this was the first official Northern rotation. It was quite successful because it was very well needed. So our 4 vet students that go, currently what they get to do is a little bit of surgery, some appointments. They answer questions and educate the public of the communities. They also do classroom presentations in the schools to the kids on dog health and safety, and they answer any questions that the kids may have. So just a little note on where the Sawtoo is. It is in Northwest Territories, close to the north, kind of in the middle, I guess you could say. But all the 5 communities are located kind of around Great Bear Lake, which you see in that top left picture. So these are just some of the posters that we have placed around the communities to inform the people in the communities who to contact to schedule the appointments and the surgeries. All these contacts are local, so they take all our appointments and do all the scheduling in advance of us even getting there, and it's a lot of work. Just as an idea, we do approximately 300 appointments when we're there in the 2 weeks over the 5 communities, and about 50 spays or neuters. So it's quite a busy time for the people who are helping us out, for sure. So our first stop on this rotation is Norman Wells. It has a population of about 770 people. Norman Wells is our home base when we're in the Sawtoo. The government of the Northwest Territories, they allow us to use their office space and their trucks. We usually have accommodations provided by Northright and other local people. So we pretty much take over the entire environmental natural resource space while we're there. They give us full access to it. As you can see, we have a lot of boxes, a lot of equipment that is needed for the rotation. These boxes are also stored in Norman Wells in a warehouse when we're not there. So for 11.5 months of the year, they have them stored in appropriate temperatures and all that kind of stuff. So we really thank them for allowing us to do that. So this is just a little picture of setting up the surgery suite. It is in progress right here, so it looks a little crazy, but every one of those boxes you saw has to be unpacked and organized and set up. So it's a lot of work. This is our reception area in Norman Wells. It shows you that we take over the office space. This is where we do our admitting and discharging and our appointments. So we cover the floors with tarps to protect them if necessary, and we really move in and take over. So this is a surgery suite in that lab space you saw. So it's just a couple of our students doing surgery on one of the first couple of days. Just a picture of some of the cages and some of our patients and one of our vet students comforting a puppy and also recovering a patient there. So everything you see in the last two pictures of the surgery and the reception, the cages and everything, after 2 days of surgeries and appointments in Norman Wells, pack everything up, load it into a truck and hit the road. So our next stop on the road, before I get there, I guess the winter roads is how we get there. As you see, they can be quite rough, can be quite, I guess, unmaintained, but yet it works for us. So we travel in a convoy of about 3 or 4 trucks. Tim Melding from Norman Wells donates his time and ensures we get to and from each community safe and sound. He's also the guy who stores all our boxes and helps with a lot of the logistics while we're up there. Because of these winter roads being as rough as they are, we can only travel about 50 kilometers an hour, sometimes slower than that. And we spend about 24 hours, give or take, in the trucks over the 2-week period. So we do a lot of traveling. There's no self-service between a lot of the communities, so we need someone who knows the road really well, and they can help us out if we have an issue. And Tim is the man for that. He's been amazing. He's helped us out pretty much every single year. So while we're on the road, we get to see some pretty cool wildlife, some fox, some muskox, and as well some caribou and ptarmigan. So it's pretty neat to see all these things up there. The very first or second clinic, so the first stop on the road is Toledo. So Toledo has a population of about 520 people. And they kindly welcome us into their school there. The picture at the top you'll see is of a classroom that they let us use. It's the setup, so we need to know what the classroom looks like before we move in, so we can put it back to the way it was. The bottom picture is the clinic. So again, we take over the classroom. So thanks to the teachers and the students who move out to let us move in. Karen, one of the teachers, has been helping organize these clinics since day one. She arranges all the appointments and surgeries and all the logistics in Toledo. A lot of the students want to help us out, and they help us out year after year after year. Namely, some Eldon, Shayla, Marshall. They're absolutely amazing, and they want to be there to help us, and we really appreciate all of their help because we could use every little bit of it because we're so busy. So this is just a picture of the surgery suite. Dr. Tuma is in the bottom left, and Dr. Aylin Attila and a student are in the top right there. The view is absolutely amazing of Bear Rock in the background, so it's a pretty cool room to have as a surgery suite. This school as well does lollipop sales for us, sometimes popcorn sales throughout the school year, and they raise money to support the vet clinic. So it's pretty cool that they do that for us. The kids gather in a group while we're there, and they actually present us with a check. And they're proud of their donation, and we're super proud of them because it's really kind for them to do something like that for us. So we pack up after 2 days in Toledo and head to Delaney. The population of Delaney is about 625 people. In Delaney, the town does a lot of the organizing, scheduling, and provides the lodging for us. So the school welcomes us there. We use the classroom sometimes, again, before we move in and the after at the bottom. We do our appointments and the surgery in this classroom, so it's a tight squeeze, but we make it work. And then we also get to use the community hall, which has a little more space. We get to spread out a little more. So as you see, there's appointments going on in the front there on one picture and then surgery in the back. After 2 days in Delaney, surgeries and appointments, we pack up and move back to Norman Wells. There we get to unpack and repack all our supplies, prepare for the next leg of the journey, and we get to regroup and have a day or so off before we head off on the next part. So the next stop is Fort Good Hope. It has a population of about 580 people. They also welcome us into their school. They provide a classroom for us to use. The secretary does all our appointments scheduling before we get there in advance of the clinics. They let us use the kitchens, as does the other schools. Sometimes in Fort Good Hope, we even get to sleep in the library at night. So that's a pretty cool thing to do as well. It's pretty cozy there. After Fort Good Hope, we pack up 2 days of there and we head north towards Colville Lake. We get to cross the Arctic Circle, which is pretty cool to say you've done. You must make a sign and hold it for a picture. So yeah, it's a pretty neat thing to do. So the final stop on the northern rotation is Colville Lake. It has a population of about 150 people, so it's the smallest of the 5 communities in the Sahtu. And as you may have noticed, all of these communities are super small, but they still manage to make it possible to accommodate an entire vet team and to support us in so many ways and to help the clinics be successful in their communities. So in Colville Lake, we set up sometimes in the gym. As you can see, the surgery suite is kind of under one of the basketball nets on one side. All the kennels on the side there. There's kids comforting some of the puppies or the dogs that are there. And in the bottom right-hand picture, you see Dr. Coots talking to some of the kids, educating them, answering their questions. And that's a really big part of what we do on this rotation is chatting to the kids and getting to know them and letting them know what we do. They're always intrigued by what we do. So in Colville Lake, the band office does all the arranging of our appointments, as well as Margaret Brown. She's a huge supporter over all the years. We've also been able to stay in her cozy cottages and cabins as well. So huge thanks to those people. So we've had a lot of support from the school kids, as I've mentioned, and I just need to stress that that's a huge part of our rotation again. In each community, we have some kids that travel with us that they just jump in the truck and go around house to house when we do house calls. They know the dogs, they know the people way better than we do. So they can show us where people live and who owns what dog. We have repeat kids, like I mentioned, Marshall and Shayla, Eldon, and there's so many more that come to help us out. And we appreciate their help. There's so many little jobs we can get them to do, and they always seem to want to help us out, so that's great. We also have noticed that some of the kids who are now close to adults or are adults are considering or pursuing medical careers. And we like to think that we've inspired some of that at least. Marshall mentioned some vet courses that he would be interested in. We actually, the University of Calgary does a virtual vet camp in the summer. This year due to COVID, it turned virtual, but it is open to all of Canada. So hopefully the vet camp, it's aged, it's I guess for kids mainly 13 to 15, give or take a year or two, but it is a great opportunity for kids to see what vet school and what a vet is all about. So the Sahtu vet clinics require a lot of support, as you'll see in this thank you banner that we have. This is from 2020. We have a lot of moving parts and a lot of people that help us out. And we couldn't do it without either one of these companies or these people. Besides all these companies, we've been very fortunate to have multiple technicians and vets from all over Canada attend the rotation so they could help out and as well to see the North, because it's a really great opportunity. Most of these people, pretty much all of them, the vets, the techs, and everybody along the way who's helped us out with logistics, most of everybody want to return. It's a beautiful area and it's a pretty amazing thing to be able to help with. So I can't talk about the Northern Rotation without speaking of Dr. Coots, Dr. Susan Coots. I just would really need to thank her for starting this rotation, for connecting us with all the communities, and for continuing to make it happen. So she was one of the ones that started it, and she's continued to do so and keep us going. She's there pretty much every single year, so could not do it without her for sure. So then I just want to quickly talk to you about Arctic Paws. This is based out of Inuvik. It started back in 2012. So the Arctic Paws Spay Neuter Assistance Program is a nonprofit organization. Their mandate is to promote spays and neuters and vaccinations and rehoming of pets and working animals in the Beaufort Delta region. Back in 2012, some community members, it was Angela McInnes, Raven Firth, and Mo Grant at that time, and many more, I'm sure, started the Forget Me Not Arctic Paws Spay Neuter Assistance Program. And they did some fundraising to offer low-cost spay neuter vet services to the animals of Inuvik and surrounding communities. So they did the fundraising in the beginning, but they really needed the help from veterinarian or veterinary technologists or something so that we could help them with that side of it. So fortunately, Dr. Lucy Levy, who's a good friend of mine, she came on the rotation in 2012, and she fell in love with the North and loved the experience. And at the same time, Arctic Paws was looking for a vet to help them out with their program. So I think it was meant to be. Dr. Lucy Levy and I jumped at the chance to help Arctic Paws set up their clinic for them. So we ordered all the equipment, the medications, the supplies, everything needed to run a clinic here in Calgary. We sent it all up to Inuvik. It started from quite a small budget, very little money at the time, but we made it work because it was really necessary up there. So just so you have an idea as where Inuvik is, it's at the top of the Northwest Territories, almost the top. It is a population of about 3,400 people. So the very first clinic that Dr. Levy and I went to, just her and I went up there. They had all the appointments and everything scheduled for us and surgeries. Nobody really knew what they were doing. They didn't, we didn't know what was happening, but regardless, the rec center provided the rooms for us. They gave us dressing rooms. We had a waiting room, a surgery suite, and a recovery room in the dressing rooms. So it was pretty neat. We were pretty skeptical in the beginning, but it worked out amazing. The hooks, the benches, the shelves, everything in a dressing room, the rubber floors, all were, you know, very helpful and well utilized for our vet clinic. So we went there, we didn't know what was going on, we were so busy. It was quite a few years since there had been a vet in town, and quite a few years since any veterinary services were offered. So we were so busy with appointments and surgeries. Thankfully, we had some amazing volunteers from the community that jumped in and helped us out. You know, whether they were doing the scheduling or the appointments or whatever, they still spent all day at the clinic with us, comforting the animals, greeting the people, helping us with discharges. We also had nurses from the human hospital that came along to help us out. They picked up on veterinary medicine pretty quickly, and they were able to help me monitor patients and help me recover them, and do so many things on the medical side of it that I greatly appreciated. We also had Ben at the bottom there. He jumped in, he was so good with animals, helped me hold patients, helped me remove catheters. He even did some tattoos for me. So it was pretty neat to have all of them there. We could not have done that first clinic without anybody. All these people were amazing. We even had locals helping wrap packs and wash instruments and all that kind of stuff. The pharmacist in town was helping us with medications that we needed that we didn't bring along. The local human medical supply company was giving us things to use. So it was pretty neat. It was a great whole community effort for that first clinic. The next one, about 6 months later, was in a school that was about to be torn down. So the school was closed, but they let us use it. We chose the home ec room, and that worked quite nicely. We settled in very well. We did bring a second vet with us because, again, we were so busy from the first time. And we had a lot more volunteers help us out this time around. So it was pretty amazing to have some people come back the second time. The third clinic, we moved along to the fire hall because the school had been torn down, and the fire hall worked great. This is the reception area that you see. It was kind of where we did exams as well. It worked out well. We did have one fire call that we had to shuffle along all the tables pretty quickly so that the firefighters and the fire trucks could move along to the call. But otherwise, it worked out really, really well. So for this trip, we added a vet and a technician along with myself and Lucy. We also added more equipment like an ultrasound and a dental unit and things like that because we realized that the veterinary services needed to be more than just spay and neuter sometimes. So this is a picture of the surgery suite. This is beside the appointments that were held in the garage where the fire trucks were, so we were able to do our surgeries with less distractions. So as you may have noticed, the Arctic Paws Clinic, that clinic started off, you know, we did just mainly anubic. However, we did sometimes have animals flown into us so we could do the surgeries for them. But as you may guess, flying animals to and from communities, remote communities, can be quite challenging, especially the time of year that we were doing these clinics. So that was recognized, and then Arctic Paws started to move or take their clinic on the road. They do travel to communities in the Beaufort Delta and set up the whole clinic there and do all the services in the clinic. So it's a pretty cool thing to move to, for sure. We started with very little and we moved along pretty good. So Dr. Tuma is a huge part of this Arctic Paws vet clinic, and I'm sure she'll talk to you more about this in a little bit. So just a quick picture of the volunteers, some of the volunteers on that first trip at Inuvik getting a day off and getting out to see Inuvik from a different perspective. And then one of the perks of working in the north is getting to do really cool things like this. The dog sledding, as was mentioned earlier, is absolutely incredible if you get the chance to do it, and to get to meet a reindeer was pretty cool as well. So in closing, I just want to mention that both of these organizations, there are many examples of capacity building. As you probably noticed, it takes the support of a lot of people to run these clinics smoothly and to pull them off. Whether it's the teachers or the principals or the secretaries or the drug companies, the doctors, pharmacists, nurses, the band offices, the local people, the airlines, trucking companies, the grocery stores. I'm sure there's so many more. We need all those people to help provide these animal health services and to keep them going. The organizations and experiences also allow everyone, including vets and techs from across the country, to see another side of veterinary medicine and to think outside the box, to educate, train, and communicate and engage each other in areas related to One Health. So that's pretty much all I have. Thank you all for having me here to speak today. And Michelle, it's your turn.
Thank you, Tanya, so much. Really nice presentation. Fantastic. I think what's neat too about your presentation is that you illustrate two very different programs that are achieving the same goal for the communities, and just it illustrates how there's no cookie cutter approach, right? Mm-hmm. Just as we get Michelle hooked up, I guess if you can pass a question, and Tessa answered this a little bit, but maybe you want to answer it or reflect on it. We do this with vet students, and there was a question about whether or not vet technology students get involved, and the answer was no, but maybe you could give a few thoughts on that and about what how you would feel that could work, or the value and your perspective.
Sorry, get involved in, what was that?
So we do this for vet students, but there's not really any equivalent for vet technology students.
To join, you mean? Sorry, I'm just trying to figure out how to switch over.
To join this rotation, or even in other situations. I don't know to what extent vet technology students will get to participate.
Yeah, I mean, on this rotation, we usually have more technicians that join me, the Northern rotation in particular, because we are so busy. But that's kind of just, yeah, just one or two that come along, just mainly because of the logistics. It's hard to have a lot of people for this particular rotation. But yeah, I guess Michelle may have some insight on how to get us involved more, for sure.
Yeah.
Mm-hmm.
We have on a few occasions started some dialogue with the vet tech programs in Alberta, but it's always been a bit of a challenge, and of course it's about timing and everything else in order to get people involved. But yeah, it would be good.
Mm-hmm. Absolutely.
Okay.
So I will make Michelle the host now. Is that right?
Yes.
Okay.
Heather Fenton has just made a comment about a vet tech student that might be doing online training from communities would likely be welcomed on these clinics, and certainly that's Jessie came up and was welcomed on these clinics, and would absolutely we make space every year for at least one additional person that brings a lot to the team and also provides some training, provide them with an opportunity to experience it. Yeah, so the other thing I think Tanya really illustrated that this is a lot of hard work. And earlier in the chat line, Katie Powell, I think you asked a bit about recruitment of volunteers and vets and how do you do that. And it's clearly a heck of a lot of work. Anybody who's ever done this knows that it's a lot of physical work. It's a lot of mental work. Sometimes there's real challenges that people have when they're coming from well-resourced clinics with clientele who are, can economically afford to go to advanced treatments. And sometimes it's quite hard on some of the people providing services to get their minds around the fact that they don't have all the tools and they can't do everything they could in the South. And so one of the things that we've really worked hard at in the last many years is providing a really good orientation for people going north. So they know the history, they know, it was touched on earlier, the issues around colonization and where communities are at, and they come in there with their expectations being not that they're going to provide exactly the same thing they could in downtown Calgary, but they're going to provide the best services they can under those circumstances, and that they are making, they are helping the communities. So. Okay, I'll turn it over, Tanya. If you've got any further, I think you can still talk if you want, and otherwise we'll move on to Michelle unless...
Yeah, I think we'll let Michelle go on, and then her and I can answer any questions at the end.
Great.
Thank you.
Okay, hi, it's Michelle. Can everybody hear me?
We can hear you.
Okay, my neighbors are drilling right now. You can't hear any background noise, can you?
Not right now, nope.
Great. If anything happens, just let me know. Okay, I'm gonna share my screen here, I guess.
You can also share your picture if you want. I forgot to remind Tanya about that. She got away with it.
Interesting. Okay, let me do this. Share this. Oh no. Can you guys see? Good?
Yes, we can.
All right. Okay, so hello everybody. My name is Michelle Tuma. I am a veterinarian in Yellowknife, Northwest Territories. And I just want to start off with saying that I am so excited to be here presenting and so honored to be speaking today about this stuff, because this is just something I'm so passionate about. And again, I'm just so honored to be involved in the ongoing discussions about how we can create a sustainable program for veterinary care in the North. So just a little bit about me. As I said, I was born and raised in Yellowknife, Northwest Territories. As Jordy earlier mentioned today, I wanted to be a vet since I was young because I've always had a passion for animals. I grew up on the land hunting and fishing. And as she mentioned as well, I grew up on her dog lot and playing dogs with her. And, being exposed to dogs and animals at such a young age is definitely what ignited the passion for animal care for me since I was young. So after high school graduation, I went to University of Alberta where I got my Bachelor of Science. And then I continued on to College of Veterinary Medicine in Saskatoon, where I graduated in 2014 with my vet med degree. I just want to say that unfortunately, I graduated a year too early because Dr. Woodsworth's remote clinic started the year after I graduated, and I'm sure I would have totally enjoyed those, but unfortunately I didn't get a chance to. So when I graduated from WCVM, I returned to Yellowknife, my hometown, to work at a private practice. I was pretty lucky at the practice I worked at. I got a lot of exposure to a lot of different cases and definitely learned early on how to be resourceful with limited supplies and equipment. I was also pretty lucky because within my first year of practice, I was approached by multiple different organizations, including Arctic Paws Spay Neuter Assistance Program in Inuvik that Tanya just discussed, as well as University of Calgary and the NWT SPCA. All these organizations reached out to me to see if I could help in some temporary veterinary clinics within the Northwest Territories. And then that's kind of how my journey into temporary veterinary clinic organization began. So here is a map of all the communities across Nunavut and Northwest Territories that I have participated or led a temporary vet clinic. So I have traveled to over 20 communities across Northwest Territories and Nunavut. These clinics have been in partnership with the NWT SPCA, with Arctic Paws, with University of Calgary Veterinary Medicine, with Veterinarians Without Borders. So I've been very lucky to have been partnered with some amazing organizations who are really helping to advance veterinary access across the North. On average, since 2015, I've been doing about 8 clinics a year. So a lot of these clinics are return clinics. So communities where we have annual clinics and go back every year. So I just want to note here too that these are the places that I have been, but I know that there are many other organizations out there that are hosting clinics in other communities as well, such as Iqaluit Humane Society out of Iqaluit, Northern Canine Rescue out of Cambridge Bay, and CAT as well, who comes from the south, and I'm sure there are more. And you know, this is why we're having this discussion today, to get everybody together and create a comprehensive plan. So these are the specific Veterinarians Without Borders clinics, and I'm going to be kind of chatting more about these specific clinics during my presentation here. So within the 2 years, so basically in 2018, I was approached by Veterinarians Without Borders, thanks to Dr. Susan Coots, our wonderful facilitator, to participate in discussions about Northern clinics. Veterinarians Without Borders wanted to start doing what I had already been doing with some other organizations. So I had the privilege of speaking with Vets Without Borders about the temporary clinics that I had been organizing for the NWTS PCA, for Arctic Paws. And I also discussed how a pilot project could be set up for Veterinarians Without Borders. This, of course, led to more discussions, and then I agreed in 2019 to lead their Northern Pilot Program project. So 3 communities were identified to participate in the Northern Program Pilot Project. These communities were selected by Vets Without Borders and the NWT SPCA based on community need. I should say I was working for the NWT SPCA at the time, and we were getting lots of inquiries from communities to have clinics in their community. So there was some criteria that Vets Without Borders decided to put in place. We reached out to multiple communities to see if they wanted a vet clinic. And then the 3 communities that were finalized for the 2019 pilot project was Taloyoak in Nunavut, as well as Fort Liard and Wrigley in the Northwest Territories. So a little bit about these communities. Taloyoak is a fly-in only community of about 1,000 people. It's located in the Kitikmeot region of Nunavut. Fort Liard and Wrigley are both located in the Decho region of the Northwest Territories, and they are accessible by road, although you do need to take a couple of ferries to get to Wrigley. Fort Liard has a population of 500. Wrigley has a population of about 120. So in some of the criteria that were needed for when we chose these communities is that there was an agreement between Vets Without Borders, NWTS-PCA, as well as the community, that they would provide the veterinary team with accommodations, food, clinic venue, and then Vets Without Borders would provide a free temporary clinic. So in 2019, we ended up doing these clinics in 2 different trips. So of course, the Taloyoak clinic, it's a flying clinic. So we did that in June 2019. The Wrigley and Fort Liard clinic, we grouped into 1 clinic because we drove there from Yellowknife, and we did that in September 2019. We did have a number of volunteers who had applied to participate in these clinics. Our teams consisted of 4. In Fort Liard and Wrigley, there was myself, 1 volunteer vet from British Columbia, 1 technician and an assistant from Yellowknife. And then in Taloyoak, there was myself, a volunteer vet from Alberta, a volunteer technician from Alberta, as well as a vet student who came as an assistant. She was from Alberta as well. So just to kind of touch based about the volunteering with Vets Without Borders, first off, the volunteer vets did need to get a license. And I know there's been some chatting about getting licenses across jurisdictions. So in Northwest Territories and Nunavut, you do need a license to practice here. It is only $250 a year in each of those territories. The process, there are some things that they ask of. So, you need to have, proof that you graduated, so your diploma. You need to potentially be registered in another jurisdiction. So there is some paperwork involved. I have heard from some people that it is a frustrating process. Honestly, for me, it was quite easy because I applied right after I graduated, so I didn't have much to have to find. But you will, if you do want to volunteer up here, you do need to have your license in place. Another thing we did provide for the volunteers as well is cultural training. And again, luckily we had amazing people like Scott McQueen, who was able to talk to our volunteers when they were in Yellowknife about historical and modern perspectives of dogs. So that is something that we at Vets Without Borders do want to continue to do, is providing cultural training, cultural context to any of the volunteers who come on these clinics. And so I know, again, to bring up Katie's question that she had asked earlier about how can we recruit volunteers to come up here to volunteer. If there are people who are apprehensive about coming to the north to volunteer or to work in remote settings, then honestly, they need to take time to I guess, become comfortable before they come here. So there are a lot of cultural differences, and we do provide cultural training. There's a lot of online resources as well, for potential volunteers to familiarize themselves with Northern context. But it definitely can be uncomfortable for some people who come up here, and that is a very big challenge to overcome. So if people are a bit apprehensive of coming to the North, then reach out, to people who are in the North. Reach out to me if you have any questions, because I'll give you all the details and let you know, there's not going to be cell service, there's not going to be internet when we're here, you're going to be totally off the grid. So it's a very different type of experiences that you can attain up here, which are amazing experiences you can have, but you definitely have to come prepared. And Claire had mentioned as well that getting prospective vets involved as students, and that is really, really such a great point, because having them get this amazing exposure to how to be more practical, how to be more resourceful, to create possibilities, that and to give them the chance to experience the North, and to gain so many different skills, is really important as well. Okay. So I'm going to talk a little bit more specifically about these clinics that we did. So as I said, in 2019, we traveled to Fort Liard and Wrigley via vehicle. So we were very, very fortunate to have both of our vehicles donated by both of our vehicle rentals donated by Aurora Ford, so a local car dealership and rental service in Yellowknife. And, this really shows how kind of local capacity building can work, and having kind of local connections, even if it's just in Yellowknife. So it was myself, Dr. Clemenson from BC, Jessica Ginter, a technician in Yellowknife, as well as Nathan Watkinson, who came as an assistant from Yellowknife as well. So we traveled to Fort. It was about a 10-hour drive from Yellowknife to Fort Liard. It was amazing fall days. It was, it sounds like maybe 10 hours is long for you guys, but as a Northerner, 10 hours is nothing, and it was a beautiful drive. We had a great time there. We had high school students who were volunteering with us. We had owners coming in and so excited to have a vet clinic in their community for the first time ever. In Fort Liard, we did a total of 30 surgeries. We saw 55 dogs that were vaccinated and dewormed. We did a couple of porcupine quill removals. In Wrigley, we had a total of 34 surgeries performed. We saw about 52 dogs vaccinated and dewormed. And, this was pretty big for these communities to have a vet there. As you can see, we did the clinics in a warehouse and in the fire hall. Again, kind of touching on being practical and resourceful with the space and with the equipment you have. Everything we had was fit into the back of a pickup truck. The equipment we were using was in partnership with the NWTS PCA. We just had to kind of go with whatever clinic or whatever clinic venue they decided to give to us. So there was a lot of getting used to different environments, but we made everything work. So in 2019, we also went to Taloyoak. So again, Taloyoak's in Nunavut. It's a fly-in only community. and we visited Taloyoak in June. The team was myself, plus one veterinary volunteer from Alberta, technician from Alberta, and student from Alberta as well. So as a fly-in community only, we of course had to fly there, and we were pretty lucky that we had the flights discounted for us to fly there. Unfortunately, cargo costs were not discounted, and that was, you know, one of the biggest kind of constraints on the budget was the cargo costs. We had about 500 pounds of equipment that was traveling with us to Taloyoak. So it was a lot to bring there, but we managed to get it all there. And one thing that I do want to kind of quickly talk about at this point as well is that, you know, we brought 500 pounds of equipment, and which of course requires a lot of costs associated with it. But Veterinary Without Borders wants to only do clinics with a specific standard of care. So all of our animals that are going under surgery have an intravenous catheter placed. They're on fluids for the surgery. The surgery is performed under inhalant general anesthesia. They receive peri and post-operative pain medications. They receive a cone. They basically are getting everything that you would get in a regular veterinary clinic, just, you know, on a table in the middle of the community rec hall instead of in an actual surgery suite. All at each clinic too, everything that we do is with owner permission. So everybody is signing a consent form. We are doing everything only with owner permission and trying to build those relationships and that trust with them. So in Taloyoak, we did about 24 surgeries, and we had 61 dogs vaccinated and dewormed there. Again, this was the first vet clinic that was performed in Taloyoak, so it was pretty well received at that point. So in 2020, we all know that there was a big problem that occurred. So COVID-19 definitely, you know, put the brakes on a lot of clinic plans. Luckily, being in the remote Northern Territories, we were relatively pretty safe up here. Even in Northwest Territories, we had about 5 cases over a short period of time. We haven't had a case in a few months now, knock on wood, and Nunavut actually had no cases. So we were lucky enough up in the north that a travel bubble was opened up between Northwest Territories and Nunavut. We were also lucky that the relationships that we had built with these communities last year and throughout the year, that they wanted us to come back. They weren't worried about there was a pandemic. We kind of made some changes to our protocols and presented them to the communities, and we received letters of invitation from every community that we had visited in 2019. So 2020, a little bit delayed, but we did get to visit every community that we visited in 2019, which was really, really great. There was a change in scheduling, so the Taloyoak clinic was postponed to the fall just because the travel bubble hadn't opened up in June yet. And so we traveled to Fort Leon and Wrigley in July. Because of the pandemic, we could not have any Southern volunteers. So I assembled a team of locals. So myself as the only veterinarian, 2 technicians, so one including Jesse Olson, who you had heard from earlier today, 1 assistant, and we also had a local photographer who came along, and you'll be seeing a video that she made after my presentation. So just to, you know, kind of stress the importance of having some local capacity. If this team and the relationships we'd built with the communities was not present, then most of these clinics would have been canceled. And we were pretty lucky that they still trusted us and wanted us to be in their community again. The only kind of thing that changed is that unfortunately we weren't able to get any high school volunteers. We weren't able to go into the high schools because of the pandemic restrictions. We were still fortunate enough to have local sponsorships again. So Aurora Ford with the vehicle rentals, the warehouses, groceries, and again, just the local support from community residents while we were visiting their communities. Because of these timing changed, unfortunately, the 2020 clinics were not as busy as the 2019 clinics, but we still, we're kept pretty busy while we were there. So in Fort Liard, we saw about 29 appointments. We only did about 9 surgeries. And Wrigley, we saw about 11 appointments, including a ferret, which was great to see in Wrigley. We did a couple of porcupine quill removals, and we did 9 surgeries in Wrigley as well. So it was really nice to see in Fort Liard and Wrigley some, familiar faces, some returning dogs. And, some of the dogs we saw on the streets, we did see them last year. We might not have seen them this year except for roaming around, but it was still nice to see that they were happy and healthy. So Taloyoak, I traveled there actually last week. I just returned on Saturday. It was a bit of a whirlwind of a trip. Because of the pandemic, things being postponed, community contacts having, their own things happening, kind of made the clinic be a little bit pushed back. So the Taloyoak clinic was actually almost going to be canceled or postponed indefinitely, but we decided that we would go there and at least just do a vaccine and wellness clinic. So we unfortunately were not able to get all of our surgical 500 pounds of equipment up there to do surgeries, but we were at least able to get a team of myself and Dr. Heather Fenton to go up there and provide some continuity of care. We flew up there. We didn't have the cargo costs, of course. Unfortunately, because of the pandemic, the airlines were unable to give us discounts either. But because of the pandemic, the flights weren't as expensive, so that was great. We were unable to have students in the clinic because of the pandemic. We were unable to go and talk to the students, but that didn't stop us from talking to the kids when they were, at roller skating at the arena in the evening or when they're at the grocery store. So we still really tried to, continue with those relationships in the community. So we ended up seeing 25 dogs and 1 cat. So the cat was new. We actually hadn't seen him last year. So it was really great to see that we were still seeing some new faces this year. Another thing to note too is that we weren't as busy because as well the caribou migration was occurring. So a lot of people were out hunting at the time. So we did try to be as accommodating as possible. A lot of people were going hunting throughout the day, so then we would meet them in the evenings to see their dogs, or we were knocking on house doors that we had been to last year, basically up until we went to the airport to see if they wanted their dogs to become vaccinated, get vaccinated or not. So that's just a little bit about the clinics that we've done. And one really important thing that I've kind of touched on, and a lot of other presenters have as well, is continuity and consistency of care. And even though the numbers of 2020 clinics were decreased from the pilot year, these clinics should still be considered very successful. Just having the presence in a community will show the residents that we care and we want to continue to come annually. We become familiar faces, we remember each other, and we really kind of put the decision in their hands, whether they want to access the veterinary care that we are able to provide. It's very important in these communities to have this effort to show that we will show up every year. And, you know, a lot of the kind of inquiries I get from communities too, it's over Facebook. You know, I'm part of their Facebook pages. I post on there that the clinics are going to be there. I get follow-up information or follow-up inquiries from residents. And, you know, social media is a really, really big thing in the North, and it's a lot of the communication that occurs within communities is over social media. So that's a really good place to kind of have a little bit of an impact and to become part of the community and to, you know, really kind of get the information out there. You know, some pet owners or some animal owners don't actually know that animals should be examined every year. Some animal owners, you know, honestly, sometimes you don't even realize that animals can receive medical care. So kind of providing this information and education to community residents is really, really important. One thing that Vets Without Borders is looking into doing as well, which, you know, the SAW2 University of Calgary rotation has done, and we've kind of piloted a little bit, is doing a dog census. So seeing how many dogs are actually in this community, and I guess animal census, because like I said, there's a cat and a ferret that we saw this year. So just to get an idea of the impact or the amount of animals that we are seeing. Dr. Tessa Baker did do some research with the University of Calgary's SAW2 rotation, you know, going through the numbers from 13 years ago to today, and the changes that they saw in the dog population from then until today, and the impact of having a regular annual clinic. And I think that's really important work, and that's something that Vets Without Borders is also looking into implementing as well. So as I said, you know, the numbers might not seem tremendously high. You know, we're not, you know, seeing hundreds of animals, even though there might be hundreds of animals in these clinics. But the clinics were still so successful because we were able to engage with community members, and we allowed the owners to choose to bring their animals in. So we left the decision to those community members. And with continued access annually to the temporary veterinary services, you know, we just can hope that the numbers of animals that are seen will increase, and that kind of just shows the continued dedication from you know, the teams that we bring up. So Vets Without Borders does plan to kind of expand to other communities over the next few years. I know that they are talking about expanding to, you know, hopefully at least providing 5 to 10 communities with annual access to veterinary care. So all the red dots, as I said, are the communities that I've been to already with Vets Without Borders plus other organizations. The green dots are other communities that have expressed interest directly to Vets Without Borders or to other organizations that I've worked for in the past about having a veterinary clinic. So, you know, I think somebody had asked in the comments earlier, like, how can Vets Without Borders help to either kind of fund or help to, make it a reality that we can get veterinary services to remote communities. And one of the really important things to remember is that the creation of partnerships with local organizations, with local communities, community members, is going to be so important to be able to provide sustainable services. This year, the pandemic put a lot of delays in the plans for expanding to other communities. However, we've been able to help out other organizations in need. So, for example, next week I'll be traveling to Cambridge Bay. Cambridge Bay has a very self-sustained program and a rescue called Northern Canine Rescue. They have a team that comes up from Alberta every year. They do fundraising. They do everything they can to provide an annual clinic. And they have really seen such a change in the, just the idea of pet ownership in their community since they've been able to continue to provide these annual services. Unfortunately, this year, because of the pandemic, their team from Alberta couldn't come up. So they reached out to me to see if I could travel to Cambridge Bay because I am local, I'm in this bubble, and I'm able to go there. So I'll be going there next week, and luckily Vets Without Borders was able to step up and help this organization as well. So there are opportunities for partnerships, and this is another reason why we're having this summit and this conversation, is to see how can we create a sustainable, regular vet program for the communities in the North, how we can collaborate together and work together to do this and to ensure that it's done in a culturally respectful and sustainable way. So just to kind of, talk about that a bit more, as we've talked about a lot, many communities across the Northwest Territories, Nunavut, and other, northern areas of the provinces have little to no access to veterinary care. There's no access to funding to support a temporary vet clinic. Some residents do not even realize animals can receive medical care. So what are some ways that veterinary care can be brought to every community? Is that actually an attainable goal? We need to also consider that not all communities may want to have a veterinary clinic. And this is where relationship building and partnership is so important. Having local trustworthy organizations, businesses, community residents to build and to expand and foster the already existing local capacity, which will result in more consistent care in the long term. So, I can't stress enough relationship building and going to these communities and having these relationships with these community members. People are curious. They want to see what's happening to their animals. Every time I'm doing surgery, I usually have the owner watching me. I'm talking to them about, vet things, what I'm doing, just anything while I'm doing the surgery. And that's really, kind of fostering those relationships and building that trust, and then seeing them again next year, right? So this top picture is Lenny and Gina, and I'm doing surgery on their dog Cujo. And I saw Cujo again this year in Taloyoak, right? So it was just really great to see them again and for them to be excited that we're there again. So we really need to kind of work with the local capacity that's already present, and work with organizations that are in the North that have these community contacts, that are able to build the relationships and trust. We all have the same goal, and that's to provide veterinary care or access to the North, and creating a collaborative program is going to be really essential. again, you know, a lot of presentations have already touched on this about, you know, animal health implications, public health implications, social and mental health implications. So decreasing disease, decreasing unwanted litters, prolonging life, you know, risk of disease transmission between humans and animals. Really a lot of public health implications that should be kind of at the forefront to see who is going to be able to step up. It's really difficult in the north, and you know, Leah was talking about frustration she's having with her in her area as well. Like, who wants to take responsibility for this? Municipal governments sometimes, you know, they want to create bylaws, they don't know how, or they don't have time. Territorial, provincial governments, it's really hard to have legislation changed, especially in the north. There's so many other northern matters that take precedence over animal health, unfortunately, and that's what we need to continue to, you know, move forward and create these relationships and create a collaborative program that we can prove that, you know, having a healthy animal population is going to improve social and mental health and public health, and then obviously improving animal health as well. One thing that I'm super passionate about too is education, and you know, working with the University of Calgary's program and going to the SAW2, they have students there. They always have students in the classroom, like Tanya was saying, helping, and that is something that we really strive to do on every single clinic that I attend. So education is so important, you know, starting them young, getting them into the clinics to see what we're doing. A lot of dogs that are owned in these communities are owned by children. So, you know, they're 6 years old, but the dog is their responsibility. So teaching them from that age and informing them and educating that how to, you know, take care of your dog, what a dog needs to be happy and healthy, is so important, because it's their minds that are going to continue to grow and continue to foster this information that we're putting in their brains. Even sometimes going to communities, and you know, when we're there and we're petting and showing love to an animal, it can really change a perception of that animal's owner, who maybe didn't know that, you know, they could provide love and care in that manner. So, you know, we talk about pet ownership, career paths, why vet clinics are important, and you know, just starting them young is so important. And I know probably a lot of the other organizations try to get out and talk to the children as well, but I just think it's so important. So, you know, I've said it many times, and I'm going to say it one more time, is we're all here for the same reason, is we want some sort of, you know, sustainable, collaborative program to be created for Canada's North, for the animals. And one thing we need to remember is, you know, after the clinics are finished, who is still there? It's the local residents who are still there. It's the local organizations who are still there. So we all need to support. We could hopefully find a way that we can support and help each other in achieving our goals together. Vets Without Borders is exploring the possibility of having animal care workers in communities. But as we've seen already a lot in discussions, there's a lot of turnover. There's a lot of difficulties having somebody volunteer, difficulties having somebody be trained to provide on-site support. So those are some challenges that we know we need to kind of discuss and see what kind of programs we can develop. And so it is one of Vets Without Borders priorities to see how we can create a program that can have training for local residents to be able to provide on-site care. And further to that, we've also been exploring telemedicine. So telemedicine, even before the pandemic, was something that was super common in the North because of the remote communities. You know, I would have nurses or just anybody really calling with any sort of dog emergencies, then we would have to coach them through them. And so now Vets Without Borders has partnered with GoFetch Health that provides kind of a 24/7 teletriage program. And we are kind of piloting that with a few local contacts we have in some communities in the North to see if it's sustainable and to see if it's practical for what their needs are. So we just have to remember that, you know, a lot of us are passionate about this and I'm passionate about what we do. And we want to go to these communities to help. We just have to always remember who is going to be left there when we're gone, and how, you know, again, expanding and fostering the local capacity that is already present is so important. Building those relationships and building that trust as well. So I guess that's it for my presentation. I see that there was a lot of comments coming up, so we'll get to them in a little bit. But first, as I said, we had a great photographer and videographer who joined us for our trip to Fort Liard and Wrigley this year. So she created a little video about our time there. And so now you kind of we'll get a live glimpse of a trip that we did earlier this year. I think, Monique, do you have the video?
So Laura's working on that. She's going to pull it up. Hopefully that it won't be on mic. It'll be on audio, on video audio instead of the mic, so you won't hear all that background noise.
Michelle, you'll just have to turn over hosting privileges to her, so she's under the Veterinarians Without Borders icon there.
Okay. There you go, Laura.
Wow, that was good.
Thanks.
It's the privileges of being the last presenter. I know how to do things now. My name is Dr. Michelle Tuma, and I'm a veterinarian located in Yellowknife, Northwest Territories. I am the Program Delivery Coordinator for the Veterinarians Without Borders Northern Animal Health Initiative program. The Northern Animal Health Initiative program was launched in 2019. When we travel to the communities, generally there is a team of 4, which consists of myself as a lead veterinarian. Additionally, in the team, there is 1 other veterinarian, 1 to 2 technicians, and 1 to 2 assistants. When we travel to communities via road, we have to unload all of our equipment from our vehicles and get it set up in our venue. When we travel to communities via air, we're lucky because the cargo company will deliver our equipment to us to our clinic venue. Clinic venues vary depending on location, but they can range from anything from a fire hall or a warehouse to a community rec center or just an empty house or building. Our primary focus during these clinics is wellness appointments, which include vaccinations as well as deworming. And we also offer surgical services such as spaying and neutering for sterilization of animals. There's also other minor surgical procedures that we can do, and we're always prepared for any sort of emergencies that might come in as well, such as laceration repairs, porcupine quills. Basically anything we try to handle as much as we can while we're there and see as many animals as we can. In addition to providing vaccinations and deworming, we also provide surgical services such as spaying and neutering. Spaying and neutering is beneficial in the animal populations in the north. Due to the remoteness of the communities, they do not have access to veterinary services, which creates a lot of potentially unwanted litters. And we can see that the population of the animals, especially dogs, can increase very quickly. Without having a veterinarian around or just being in a remote area, this can lead to many dogs being on the streets and can lead to dog population problems. Spaying and neutering helps to prevent that increase of the dog population. It also helps to prolong lifespan, decrease the chance of certain diseases, and helps to decrease territorialism and competition amongst dogs on the street. The Northern Animal Health Initiative program was launched in 2019, where we visited 3 communities, Fort Liard and Wrigley in Northwest Territories, as well as Toloyoak in Nunavut. These communities were revisited in 2020, and we hope to continue to offer veterinary services to these 3 communities annually long term. In addition to annual visits to these 3 communities, Vets Without Borders hopes to expand to many other locations across Canada's north. In the next 5 years, the goal is to expand and to include another 5 to 10 communities which will receive annual vet visits long term.
Great video. Thank you. Thank you, Michelle and Tanya, for the great talks. We've got a little bit of time here for some questions. If anyone has any for Michelle or any follow-up ones for Tanya, we'll try to keep it a little bit short because we're running near the end here. But please go ahead if there's any dying questions here.
Susan, it's Michelle. I'm just looking through the comments here, and I see that Lisa had asked if I do a lot of humane euthanasia, and how do you transport controlled drugs from community to community? Is it okay if I answer?
Yes, please do.
Okay. So yes, in these communities, depending on the community and our the presence in the past of veterinarians, we do have inquiries on humane euthanasia. So that is something that we do. And in terms of transporting controlled drugs, we're lucky in the north because when you're traveling north, you actually don't have to go through security. So I bring the medications with me on carry-on. And I know that that's a hurdle for some organizations who are coming from the south, and I'm not sure how they overcome that hurdle. But that's something that's fortunate that I'm local and can travel without having to go through security with a bunch of medications.
Another question there, Michelle, from Valley about can you discuss how you approach communities to discuss offering vet services?
Yeah, so, you know, we actually don't approach the communities to offer vet services. With all of the communities that I've traveled to, the communities have approached us in some way. So in the way that is through, again, the local organizations that are already present. So Arctic Paws in the Beaufort Delta, University of Calgary is doing the SAW2, Northwest Territories SPCA, that the communities will actually approach these organizations for the chance to have a veterinary clinic at their community. So we actually haven't had to, you know, go to or approach a community and say, do you want one? Because there's been so many inquiries coming in. And I'm pretty sure, I think it's the same in Nunavut as well with what Cal Humane Society has been experiencing, that a lot of communities have been approaching them to have community clinics there.
That's great. I think maybe that's really increasing it. Like it's a word of mouth thing where communities start to trust it and go, hey, there's an opportunity to build this, right?
Yeah, definitely. I mean, when I was just in Toloyoak and I was, you know, posting on the Buy Sell Facebook page, and I actually had so many private messages from people in Joe Haven in Kugaruk in Kugluktuk asking when a vet is going to come to their community. So it's, a lot of people are, hearing about these community clinics and wanting them to be in their community as well, which is great.
That's great. Danny, I see you asked a question if there's any overlap with your work and the CSU Alaska Vet Med rotation. Michelle?
Sorry, what's the question?
Is there any overlap with the work that you're doing and the CSU Alaska Vet Med rotation? I think that's Colorado State University, Alaska Vet Med. They've got a joint program.
Oh, yeah. I mean, I don't know what that program is, so
I guess
not. But, and one thing too, and I saw in there that there is somebody from Yukon who's in the chat as well, is the, Yukon is also a territory and has many communities that potentially want clinics as well. But the access to those communities is a bit different in Yukon than it is in the Northwest Territories and Nunavut. We just, the Northwest Territories and Nunavut is kind of in this little bubble that we're able to travel around here pretty easily. I mean, it wasn't until recently that there was actually a flight from Yellowknife to Whitehorse. Yukon and Northwest Territories hasn't really been as connected except for in the north and the Beaufort Delta. So I'm not familiar with the Alaska program either, and I'm not sure if anybody from Yukon is familiar with it.
Okay. I just want to point out a comment that Danny had made about PetSmart funding band councils directly, so they can choose the provider to provide animal care. So I think that's a really good thing to know about and share with communities as well. The other thing, I just want to do a little shout out to PetSmart also for funding a project that is going to be Pan Veterinary School Canada wide to look both at mental health of healthcare providers as well as the community liaisons, as what do they see, what are the needs that they have in the community, and what do they think the vet team can improve on as far as preparation, communications, etc. So just wanted to mention that. Okay, I think there's been a huge amount of traffic on the chat line, lots of really good discussion about how to, the approaches that our speakers have provided this afternoon, also this morning, and I think really has been a rich discussion and conversation. I have to read out a question that starts as uncouth as this may be. What supports are in place when visiting vets travel to communities and have no choice but to euthanize a pet? How are the pet remains addressed? Are they addressed by the community? Can you expand on this? Michelle?
Yeah, so that's a great question. When we are in a community and there is euthanasia being performed, it's actually really community dependent. So in communities like Inuvik or around Inuvik, the town of Inuvik is pretty great at providing access or providing their incinerator to cremate the animal. Otherwise, a lot of the euthanasia that I've done have actually had a cultural cremation as well. So the owners have a ceremony for their pets and will cremate them on their own. We have them, of course, sign euthanasia consent forms and aftercare forms in that they understand that their pets are being injected with a lethal solution and they need to properly dispose of the body. So it's really dependent on each community. In some communities, I've had to transport the animals back with me to Yellowknife to be cremated here and to be disposed of properly.
Great, thank you. It always depends on the season as well, as far as what can be done with the bodies. Okay, do we have any other questions? there's no more specific questions for Michelle or Tanya. Oh, do you do dentals, Michelle? Do you want to respond to that one?
Yeah, it depends which organization we're working with. So Arctic Paws has so in the Beaufort Delta, we do have a dental machine there. NWTSPCA just recently purchased a dental machine as well. So we do have the capabilities of doing dentals, but it depends on what the demand is in the community and what we need to prioritize. Because the reality is that sometimes we go to communities and we're so busy that unfortunately, we have to prioritize kind of what we're seeing. But we definitely try to do dentals when we're able to and we have the time and capabilities.
Great. Okay, this has been fantastic, folks. We could probably talk all day, but I know it's getting late in many jurisdictions and we want to do our best we can to finish this up in time so people can get home to where they need to be, or most of them are probably home already. So with that, I want to turn this over, I'm going to turn it over to John Van Leuven, who